Welcome to the Catholic Diocese of Wichita. Our diocese is excited to offer you this opportunity to learn more about the medical benefits we offer. You are an eligible employee if you are regularly scheduled to work 30 or more hours each week. If you enroll in the medical plan within 31 days of your date of hire, coverage will be effective the first of the month, coinciding with or following your date of enrollment. To enroll, you must complete, sign, and date the enrollment form and submit to your benefit coordinator within 31 days of your date of hire. Our diocese offers single and family coverage. When enrolling in family coverage, covered dependents would include an employee's legal spouse of the opposite sex. Common law spouses are not included. Also included are children up to the age of 26, legally adopted children, children for whom the employee has legal guardianship, children that meet the definition of disabled, and stepchildren, provided the natural parent remains in the household and married to our employee. If you meet the eligibility requirements, you are able to enroll in our diocesan medical plan when initially hired. You may also enroll or make changes in December during our annual enrollment or within 31 days of a qualifying event. Qualifying events include marriage, divorce, birth of a child, death of a child or spouse, or if your spouse or dependent begins a new job or has a loss of employment. If you have a dependent who becomes eligible or loses eligibility for Medicaid or children's health insurance, you may make changes to their coverage or enroll them in our coverage within 60 days of the event. Our diocesan medical plan is self-funded. This means the diocese assumes the risk for every dollar of health care expense our employees and their families incur. The dollars collected through your portion of the premium, as well as the diocese portion, are used to pay claims and the administration costs of the plan. We also share in point-of-care costs such as coinsurance and copayments. Self-insuring our medical plan benefits the Catholic Diocese and our employees in many ways. Our benefit dollars go toward benefits. We have more flexibility in the design of our plan and in contracting with the plan's networks. We have more control, which gives us the ability to cover those things that are a part of who we are, such as natural family planning classes. Participants assist in keeping costs down. As a participant, our employees understand how important cost savings are. When faced with a provider who prescribes a brand name drug, you have the ability to ask if there is a similar generic that might work as well. Generics cost as much as 75% less than their brand name alternatives and provide great cost savings. The Catholic Diocese of Wichita utilizes a preferred provider network. Preferred providers have contracted to provide services at a reduced rate. A provider directory may be accessed from our website at www.catholicdioceseofwichita.org. Once on our site, you may click on Ministries and Offices, Human Resources, and Links. Our diocese is blessed to offer a medical plan that provides rich benefits to our employees. 60% of the full premium is paid by the diocese, and 40% is paid by the employee. The monthly premium for an employee enrolling in single coverage is $253. The monthly premium for an employee enrolling in family coverage is $545. I would like to explain some of the benefits offered through our diocesan medical plan. Our plan covers basic general health benefits such as hospitalization, surgery, X-ray, lab work, anesthesia, maternity, ambulance service, MRIs, and CT scans. Our vision benefit allows for one eye exam per year that will be covered up to $90. We also cover up to $200 every 2 years for glasses and contacts. We encourage our participants to utilize the wellness benefits our plan offers. Our wellness benefits are covered at 100% if the service is provided by a preferred provider. This means that the deductible and coinsurance are waived. Covered services include routine immunizations, colon rectal cancer screen, mammogram, pap smear, PSA, routine physical exam, colonoscopy, hepatitis B vaccination, chickenpox, tetanus and meningitis immunizations if required for school admission, flu shots, pneumonia, and shingles vaccinations if recommended by a physician, and natural family planning if provided by our Diocesan Family, Life, and Natural Family Planning Office. We offer a wonderful prescription plan. Generic prescriptions have a $10 copay, and a name brand requires a $35 copay. If you are taking a maintenance drug that falls under our guidelines, you may be able to obtain a 90-day supply at a reduced cost. For a generic maintenance drug, 90-day supply, the cost is $20. For a name brand, the cost is $70. Under our prescription coverage, we have elected specific guidelines to assist in controlling costs. One of these guidelines is our generic mandate. This means that your provider is required to prescribe a generic when available. If a brand is dispensed when a generic is available, the employee will be responsible for the difference in cost between brand and generic. We also have a guideline called quantity limitations. This guideline limits prescription quantities for quality and safety reasons. These limits are based on accepted medical practices and determined by the recommendations of the manufacturer and the FDA. Step therapy guidelines require a step approach to receive coverage for the following medications: arthritis, cholesterol, and/or GI ulcer drugs. Normally, the initial step is to utilize generic drugs. Tested and approved by the FDA, the generics provided by the plan are effective for treating most medical conditions. If the first step is not effective for the patient's condition, they will be moved to the next step, which is usually the utilization of brand name drugs. Specialty pharmacy provides coverage for medication used to treat disease-specific conditions. Plan participants will be allowed to receive 1 month's prescription from their local pharmacy. After the first prescription is filled for specialty pharmacy class drugs, Prescription Network of Kansas will contact participants and establish a specialty pharmacy to continue providing their prescription. In addition to the premium you pay, what other medical costs do you need to be aware of? Our plan has an upfront deductible of $500 per person and $1,000 per family per year. The deductible is the amount of your medical costs that you have to pay before your health insurance kicks in. Once your deductible has been met, the coinsurance is based on whether or not your provider is in-network or out-of-network. An in-network provider is referred to as a preferred provider, and their covered services would be paid at an 80-20 rate. For example, if John is injured, has met his deductible for the year, and he seeks treatment with a preferred provider, the health plan will pay 80% of the cost of the rest of his covered bills, and he will be responsible for the remaining 20%. Remember, wellness benefits provided by a preferred provider are paid at 100%. An out-of-network provider's covered services would be paid at a rate of 70-30 for charges considered reasonable and customary. For example, if John is injured and has met his deductible for the year, but he decides to go to a non-preferred provider, the health plan will pay 70% of the cost of his covered bills. He will be responsible for the remaining 30% as well as any charges above the reasonable and customary amount. To put this in perspective, let's say John spent 1 day in the hospital and was charged $1,500. If the allowed charges were $1,000 and he had met his deductible, the insurance would pay 70% of the $1,000 or $700. He would be responsible for the remaining $800. So in addition to the $300 that was 30% of allowed charges, he is also responsible for the full amount of $500 that was over and above the allowed charge. Our plan has a $25 copay for office visits. This would apply to the consultation only. Services provided beyond the consultation would fall under your deductible and coinsurance. Our out-of-pocket maximum for an in-network provider services is $1,500 per person and $3,000 per family. For out-of-network provider services, the out-of-pocket maximum is $2,000 per person and $4,000 per family. The premium you pay for medical insurance includes dental coverage. Our dental coverage has a separate deductible, coinsurance, and maximum benefit per year. The dental deductible is $50 per person and $150 per family per year. The maximum dental benefit that will be paid for coverage services on an annual basis is $1,500. Preventive dental services are paid at an 80-20 rate and the deductible is waived. Preventive services would include annual cleanings and diagnostic x-rays. Basic services such as fillings are covered at an 80-20 rate after the deductible has been met. Major dental services such as crowns and inlays are covered at 50-50 once the deductible has been met. Under our dental plan, orthodontics for dependents under 18 years of age is covered at a 50-50 rate up to a maximum lifetime benefit of $1,000 for covered expenses. Any charges over $300 should be submitted to insurance and approved prior to treatment. As the Catholic Diocese of Wichita, we are committed to providing great benefits that are focused on our Catholic teachings and truly a part of who we are. For this reason, some services are excluded from coverage because they are against our Catholic teachings. These would include contraceptives, in vivo or in vitro fertilization, services related to abortion and birth control, and sex changes. Our medical plan has a pre-existing clause for those 19 years of age or older. This would apply if you have had a gap in insurance coverage that was greater than 63 days. Here is how pre-existing works. If you enroll when first eligible, anything you or your dependents older than 19 years old have been treated for or diagnosed within the 90 days prior to your effective date will not be covered for 240 days. If you decide to enroll at a later date, during an annual enrollment or due to a qualifying event, anything treated or diagnosed within the 6 months prior to the effective date will not be covered for 18 months. Keep in mind that if you have not had a lapse in insurance coverage greater than 63 days, you will not have a pre-existing waiting period. In this case, you will need to provide our insurance company with a certificate of credible coverage, also referred to as a COCC. This is a form you may obtain from your previous insurance company that certifies your previous coverage, dates of coverage, and dependents who are covered under your previous insurance. In effect, the certificate waives all pre-existing limits provided you can establish prior coverage. Thank you for taking the time to view this presentation. We hope you found it both informative and helpful. Remember, if you're eligible and would like to enroll in medical benefits, please complete the medical enrollment form, sign, date, and return to your benefit coordinator within 31 days of your initial hire date. If you have additional questions, please contact your benefit coordinator. Thank you.